name is Rob England, Executive Director for the California Alliance for Retired Americans. And we are here today to tell Congress to stop taking our health care.
Stop taking our health care.
This April, people from across the country are coming together to fight back against efforts to rip health care coverage away from working families, seniors, and people with disabilities. Congress promised lower costs. Instead, they gutted Medicaid, ended the ACA tax credits, and put hospitals at risk of closing, all while handing more tax breaks to billionaires. Now, Republicans want to make even deeper health care cuts to pay for their unnecessary war, and it's time to stop. The health care heist needs to stop. Stop taking our health care. We're mobilizing to hold lawmakers accountable, to stand up for everyday Americans, and to demand that Washington Republicans stop taking our health care to pay for their billionaire tax breaks and the Iran war.
Stop taking our health care.
I want to thank everyone for being here today, and I want to give a very warm welcome to John Bowser Bauman, President of Social Security Works PAC, and introduce him to the mic. Thank you, John.
All right, thank you, Rob. And yes, we are here to get Congress to stop taking our health care. Stop taking our health care. Health care, not warfare. Look at this sign, everybody. Health care, not warfare. And we're here specifically to protest the activity that's been happening in California's 22nd Congressional District. The House member there, David Valadao, has persistently gone after people's health care, despite the fact that his district has more Medicaid recipients in it than any district in America. Just listen to this. This is unbelievable, because the average congressional district has about 750,000 people in it, and 22 is no exception. There are 527,000 Medicaid recipients in David Valadao's district, California 22, 527,000 out of approximately 750,000, and yet this member of Congress voted to rip away health care from those 527,000 people. This is unbelievable. How can somebody make such an irresponsible vote as to vote for the big, ugly bill that cut $1 trillion out of Medicaid? That is what it does, and David Valadao voted for it and then tried to take some votes afterward to sort of, make up for it, but they didn't work, of course, because if you are part of creating the problem, you don't get credit for then pretending that you're going to fix the problem. Look, I'm standing here on a day when this morning on the way up listening to the news, we found out, okay, the Strait of Hormuz is apparently open at this moment. Great, but you don't get credit for trying to fix the problem that you created. So this administration shouldn't get credit for trying to fix the Iran war problem that it created. Healthcare, not warfare, is what we want. And David Valadao gets no credit for trying to sort of fix the problem that he created when he voted for the big, ugly bill. That vote haunts David Valadao all through this election. And we are going to change that seat. All I can say is whoever comes out of the primary to run against David Valadao in November has got to end up doing this. Because that's the way my alter ego, Bowser, would put it. So, as Bowser might say, in summary, bum 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 dang a dang dang a ding a dong ding. Stop taking our health care. All right, everybody sing. Oh, no, never mind. Stop taking our health care. Stop taking our health care. One more time. Stop taking our health care. Thanks. Back to Rob.
Thank you so much, John. All right, next I'd like to welcome to the mic my other good friend and U.S. Army veteran, Sam Hardman.
Thank you. My name's Sam Hardman. I'm a veteran. I have 18 family members that have served this country. Service is something I know a little bit about. And that's something that David Valadao, Vince Fong, and Donald Trump know nothing about. They have no idea what it is to care for another person. I was a military brat, so I know what government health care is like. As a child, I used to go to the base hospital. As an adult, when I was in the Army, I'd go to the Army hospital, and now I go to the VA. I know that the government can provide very good health care. It's perfectly possible. There are countries around the world that do this. But in our country, we're told, no, it can't happen. The reason it can't happen is because the bankers, bosses, and billionaires don't make money off of it. They don't understand that it's a service, not a commodity. Their idea is that it is a commodity and we should just die. You know, I have my granddaughter's picture here. She had been born with a heart condition. Her insurance covered the first 2 surgeries after her birth, but when she needed a third one, they said, sorry, she's run into her lifetime limit. She's just going to have to die. Sorry, that's just the way it is. Well, my kids quit their jobs, went on welfare, got Medicare in Oklahoma, and through Medicare, she got the 3rd surgery, and she's doing great now. She's growing up and she's being very healthy. But that's against what the bankers, bosses, and billionaires want. They want to make profit, and they didn't see her as a profitable commodity, so just let her die. This is the face of someone that they would let die. I'd like for you to look at that. That's important. Now, she's not the only one in our family that has had their life saved by government health care. My wife also had surgery for a medical condition that would have cost her her life. I have cancer. The VA's taking care of me and my cancer. Government can provide these services, and they do it effectively and efficiently and financially in a reputable, responsible way. But the GOP, they don't see how they can make money off of this. And they are all about making money. Vince Fong, David Valadao, and Trump are ripping this country off left and right. They want to spend another $1.5 trillion on a national defense. But in order to do that, they've got to cut Social Security, they've got to cut Medicare, and just say, you know, tough, that y'all folks have to just get along. Now, I spent my whole life planning for this point in my life, now that I'm retired, that I'd have my VA benefits, that I'd have my Social Security benefits, and I could retire comfortably. And I am right now, but it's all threatened because the GOP want to take it away. Now, we have a primary coming up in June, early June. I think it's the first Tuesday of June. I want to encourage everyone to go out and vote. Vote Democrat, vote blue. Let's get the GOP out of office. They're not representing us at any level, whether it's a federal government or in our counties. Our Board of Supervisors constantly hold money back. So it's important to understand that you do have power, and you need to stand up and use that power because we don't have the money they have. They can run ads and tell us all kinds of lies. We've heard their lies for years about how it's not doable. But if you look around the world, they do public health care in many developed countries, and they do it well. And those countries look at us and are amazed that we live with what we've got. So what I'm here to tell you is that I'm about service. I'm all for service for this country. I should be retired and enjoying my grandkids and fishing. I shouldn't have to be here standing up for the rights of others. But it is important that my grandkids and my children and the other people in these communities get the benefits that are deserved them, because the country is stronger when we're healthy. CalCare is a nurses-sponsored program in California to provide health care for everybody. Dental care, vision care, it doesn't matter. You go to a doctor and they take care of you. And they've got it worked out to where it'll actually save us money. But we have to get behind it and call our state representatives and say, support CalCare, because the bill's in the state legislature now. So you can make a difference. Get on the phone, make phone calls, talk to your family, get out there and make a difference. Thank you.
All right.
Nice job, Sam.
All right, Sam.
Power to the people.
All right, Sam.
Power to the people. Power to the people. Power to the people.
And stop
Taking
our
our
health care. That's right. Thank you so much, Sam, for that. All right, next I want to invite to the mic my sister from SCIU 521 Retirees Chapter, Eloise Coleman.
All right, Eloise.
Thank you. Go, girl.
Thank you. I'm not a very special thing. I'm not somebody that stand out in a crowd. I'm not somebody that's the leader of the pack. But I am a person that spent 30 days in this very hospital at age 13 with rheumatic heart disease. And then another bout with uterine cancer when I was 31 in this very hospital. And through all that trauma, I did have a son, and he is gorgeous, if I do say so myself. But we need Kern Medical Center. Used to be Kern General. We need Kern Medical Center. We need our funding, and we are tired of people attacking Medicare, attacking the funding. Now this is my godson. This is Jacob. Jacob was not born in Kern Medical. He was born in another local hospital. Jacob was very, very ill. His ascending aorta was all jacked up. He needed open heart surgery. But instead of this hospital helping him, because they are run by money instead of health care, a nurse ran up to Jacob's mom and said, take that baby to Kern Medical Center. Brought him over here, did whatever they do. Next thing we know, Jacob is going to Madeira to have that open heart surgery. Now little Jacob is 24 years old. And we don't know what either one of the kids of these kids gonna do. And if you cut life short because you watching the dollar, what are we gonna miss? We're gonna miss a citizen of the United States that can do anything. We are, I believe, the greatest people on this planet. And we have to stand up from the lowest to the highest. We are one, USA. Thank you.
Thank you,
done.
Eloise.
Yes.
All right.
Very well. Here you go.
Thank you so much, Eloise, for that. Next up to the mic will be SCIU 521 retiree and CARA member Gil Garcia. Come on down, Gil.
Thank you, Rob. I think we realize the dilemma we're in right now after hearing these three speakers. You know, we realize that this country, in terms of taking care of its people, isn't taking care of its people. I wish we weren't the richest country in the world. That way we could have an excuse. We could say we're just too poor and we just can't afford it. But just the opposite is true, unfortunately. You know, our budget for 2026 is $7.4 trillion. The current administration, through the big, beautiful bill, over the next 8 years is going to be cutting another $534 billion. Trump is already saying in order to pay for the war in Iran, where we're spending between $1 to $2 billion, depending on how many bombs we drop in a single day, that we can't afford to pay for that war unless we make cuts someplace else. If you notice, whenever there's an economic crisis, the people who suffer the most are those who are the most vulnerable. that means those people who are not million or billionaires are the ones that suffer. They're the ones that need the programs most, but they're the first to go. When we talk about Medicare, the Medicaid, when we talk about 1935, when this country decided that it needed to create a social net, a welfare net for people, especially for the elderly and the disabled, because we didn't have retirement plans during the crash of 1928, stock market crash, and then entering into the war in 1941, the economy and the people were struggling. Just like now, if we don't have insurance, then we don't go to the doctor. And we especially don't walk into this hospital because we can't afford the hospital fees, unfortunately. I myself, I'm a Medicare recipient. For me, Medicare was paid for out of my paycheck. For the 45 years that I worked in my life and continue to work and paying Medicare taxes to be able to afford the insurance at my end. So the health care for me was not something that I earned per se in terms of just being a U.S. citizen. It's something that the federal government mandates that we pay into so that when we reach the age of 65 or when we retire, that we can have a medical benefit so that we are not destitute due to the health care costs. But today, the current administration wants to take that away. What does that mean to me? What it means is that I will lose everything I worked for. That means if I became ill and I couldn't afford those catastrophic health costs, that I would have to probably move in with one of my children. I would be a burden to them. We don't realize the impact that's going to be happening over the next 8 years. And that impact starts this year in 2026, where cuts to Medicare are going to mean that doctors aren't going to accept Medicare in terms of health insurance. They'll have to cut staff. Just like we have here at the hospital, they have to lay off nurses because the budget based on the Medicaid cuts so far are not going to be able to support the staff that they have. What does that mean? That means it's a bigger burden for the people that are working here. That means that the floors that have been servicing by a dozen nurses or so, now they're going to have to do with maybe 10, maybe 11, not counting nurses that call in ill or sick. We found out that during COVID that nurses were super burdened. And out of that burden, they burnt out and left the industry. We don't want that to happen again because we realize the value not just of nurses, but the value of the medical staff. My son had a near-death experience. Yeah. He was walking down the street here, ran into a gentleman who asked him where he was from, and my son's response was, "Hey, I don't know you." And before he could say his next word, the gentleman pulled out a knife and struck him in the neck. Just missed his artery, but he was bleeding out. Yeah. If it wasn't for a passerby that saw him and threw him into his car and brought him here, he would have been dead. The amount of cost for the surgery that he needed, that life-saving surgery, was astronomical. But thank God for my private insurance, and then since he was over 18, he qualified for the indigent care. So between those two, we didn't have to sell our house. But I could imagine if those cuts had been implemented during that time period, I don't know what we would have done as a family. I just know that we have to just stand up and tell Washington to not make any more health care cuts, that they need to save our health care. Right?
Save
our health care.
Healthcare.
Thank you.
Thank you so much, Gil. Appreciate it. Go ahead, come through. It's fine. All right. Finally, I want to bring on our final speaker, my sister and a leader within the California Alliance for Retired Americans, Imelda Ceja.
Imelda.
Thank you, Rob. My name, again, is Imelda Ceja. I serve as a Kern Community Action Team Chair for the California Alliance for Retired Americans. I've lived in Bakersfield 41 years. I've dedicated my life to public health and community empowerment. For 23 years, I worked for the Kern County Public Health Department, helping families connect to services and access to care they needed. I also had the honor of serving 8 years on the California Board of Registered Nursing, where my responsibilities was to protect the health, safety, and well-being of the public. And through my work, I saw firsthand how poverty and the lack of access to care affected families every single day. Those challenges are only getting worse. Again, they're only getting worse. According to public reports, Republicans in Congress have taken action that increase healthcare costs for Americans, including cutting Medicaid, for us it's called Medi-Cal, ending enhanced ACA tax credits, and reducing funding for rural hospitals. As a result, premiums are rising sharply. At least 1.5 million people have already lost coverage, and millions more expected to lose coverage in the coming years. Now, we live in a rural community. This hospital shuts down, or any of our hospitals, we're two hours away from Los Angeles, 3 hours away from Fresno. We're going to die here because we're not going to have access to health care. A lot of our federally qualified clinics was shut down. We can't let that happen. With that, together, we will fight for care, dignity, and a healthier future for all. Together, we fight for care, dignity, and healthier future for all. Together. Families are already struggling with higher prices from the tariffs that are now being forced to choose between affordable health care, health insurance, and going without entirely. Health care is a right, and we will never stop defending it. Health care is a right, and we will never stop defending it. 15 million Americans are projected to lose coverage because of these cuts. Hospitals and clinics are already closing, and more than 300 rural hospitals are at risk of shutting down. How many times have they threatened to close down our county hospital? Too many times. We cannot let that happen. These cuts don't just raise costs, they put lives in danger. Public analysts show that tens of thousands of people could die each year from lack of affordable health care. Yet these policies move forward despite these warnings. How dare they? When we stand together, we protect each other and we win. When we stand together, we protect each other and we win. I spent my entire career fighting to protect the health of our communities. And I tell you this, access to health care is not a luxury, it's a lifeline. And when that lifeline is cut, people suffer. People suffer. So let's keep fighting for the care every American deserves. Let's keep fighting for the care every American deserves. Thank you so much.
All right, Imelda.
Thank you so much, Imelda. And to close us out, I'm going to bring back to the mic our good friend, John Bauman. Take it away.
So, I began this program by talking to you about the congressmen from this area. There are actually two, California 20, Vince Fong, and California 22, David Valadao. They both voted for the big, ugly bill, a bill that cuts $1 trillion out of Medicaid. It also cuts half a trillion dollars out of Medicare, which hasn't been talked about that much. It cuts an amazing amount of money out of food stamps for people. The cuts are legion in the big ugly bill. It never should have been passed. We've been trying to undo those cuts ever since they were made, and there is simply no excuse for these members of Congress to have voted for that bill that endangers Kern Medical right here. And if Kern Medical survives, but other hospitals in the area don't, then the people from those areas that close and will come flocking to Kern Medical and overwhelm Kern Medical. So we're going to have a domino effect from the big ugly bill. The whole situation is awful for every American, and we're going to have to try to figure out how to deal with these votes that were taken. Now, I've had in my hand this entire time the Alliance for Retired Americans Congressional Scorecard, and I've had it for a reason. Obviously, we're here with CARA, the California Alliance for Retired Americans today, and I find this scorecard that the Alliance puts out to be incredibly valuable. What it does is it rates every member of Congress according to how they vote on senior issues. Senior issues being Medicaid, Medicare, obviously involve a lot of seniors. So every year they take 10 senior issues and evaluate every member of Congress on how they vote. You get 10 points if you voted correctly. You get 0 if you voted incorrectly. And I want to tell you, as I stand here, let's look at the 20th District first. Vince Fong in the 20th District, his lifetime rating so far, he hasn't been there for that long, but out of 100, his lifetime rating is 6. 6. Okay? Now, Vince Fong doesn't even bother to try to portray himself as any kind of moderate. David Valadao in the 22nd District does. His district is actually got some numbers that run heavily against him. After Prop 50, they're even a little bit more heavily weighted against him. So he's constantly trying to say that he is really a moderate, even though he voted for the big ugly bill, which ain't moderate. And in his career, let me tell you exactly how moderate he really has been on issues that affect seniors. His lifetime rating, and he has been there for a long time, so this is a big sample. Out of 100%, David Valadao's lifetime rating is, give me a drum roll. Okay, that's good. 11. 11 out of 100. 9 out of 10 times David Valadao votes wrong for the seniors of this district. Votes wrong for people who need health care. Votes wrong. Shame, that is right. Shame, and it's time to go. This is more than enough. This is not moderate. This is anything but. So we're going to sing a little song. We don't have a piano. We don't have accompaniment, but you guys can try to join in. It goes like this. Do, 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 do. Good night, David Valadao. Well, it's time to go. Do, 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 do. Good night, David Valadao. Well, it's time to go. Do, 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 do. Don't hate to leave you, but we really must say good night, David Valadao. Good night, and take Vince Fong with you. Good night, David Valadao. Good night, and take Vince Fong with you. Good night, David Valadao. Stop taking our health care. Yeah. Thank you, everybody, for coming. Stop taking our health care, and we'll see you soon. Yay.